it's true that up to now, Greece has not officially recognized geriatric medicine, and so there are no physicians practicing as geriatricians in Greece. However, there are several Greek people, medical doctors and allied healthcare professionals who have studied geriatrics abroad or who had a continuous education closely related to geriatric medicine. During the last 4 or 5 years, these people get to know each other, and they have gathered around the very fortunate event of the organization by Athens of the 17th EuGMS Congress in 2021. We decided to create a working group gathering together healthcare professionals with a formal education in geriatric medicine and or a genuine interest in geriatrics. The aim of this group is to contribute to the development of geriatric medicine in Greece from the point of view of scientific experts in the field. Up to now, the group counts close to 20 people, medical doctors and allied healthcare professionals. And during the first year of its existence, it has accomplished several goals and activities.
Greece is a country where geriatrics isn't officially recognized as a specialty or subspecialty, so the need to integrate geriatric competencies in medical education is tremendous. In the past 5 years, the president of the Medical School of Athens has recognized and responded to this need and reached out to a few of us that have been trained in geriatrics in other countries in order to create the first postgraduate medical education program in geriatrics. We have seen a great response from the medical community in Athens, younger and older physicians who are out practicing and realizing that there is a better way to take care of their patients through learning geriatrics. The feedback that we are getting is great, and working for creating this project has been very rewarding for myself and everyone involved.
In Greece, in contrast to other European countries, there is not yet a nationwide strategy and a well-defined legislation framework concerning the palliative care. Notwithstanding this, some great initiatives have taken place on a public and private level in the last 20 years, reflecting the growing needs of this type of care. According to the National Committee for the Development and the Realization of a Strategy in Palliative Care, currently there are 3 active programs of specialized palliative care, including geriatric palliative care, 40 oncologic departments and 57 medical offices dealing with the management of chronic pain. They are all important but not adequate to cover the estimated needs.
Hello, my name is Manos Mirnakis and I am Associate Professor in Primary Health Care and Medical Education in School of Medicine in Aristotle University of Thessaloniki. In Greece, Geriatric Medicine is an elective course in 2 out of 7 medical faculties. Medical graduates of the future should be knowledgeable and skilled in the care of older people, as the number of people more than 60 years old worldwide will increase. Recently, geriatric medicine was introduced in the core curriculum of medical studies in Aristotle University of Thessaloniki. The teaching in geriatric medicine should be an integral part of the core curriculum, starting early in basic science and progressing through to the clinical teaching. Geriatric medicine is not a medical specialty in Greece. On the other hand, we have a new curriculum for general practice. It's really important the new generation of general practitioners to be trained in the care of older people.
Hello to everybody. Greek Alzheimer Association, Alzheimer Hellas, was created in 1995, and since then we have succeeded many of our targets. We created day centers all over Greece, and in these day centers we do prevention strategies. We use prevention strategies for elderly with cognitive problems, but also we provide care for patients with dementia and their caregivers. Also, we have the opportunity with healthcare professionals to go to their homes, to the homes of the patients with dementia, and give them the help they need.
A couple of years ago, here at Henry Dunant Hospital Center, we introduced a multidisciplinary geriatric assessment unit. It's the first of its kind in the country, and we're aiming to promote solid and useful healthcare services to older people.
At the same time, we intend to become an educational, research and clinical hub for geriatricians and other healthcare professionals participating in multidisciplinary geriatric assessment teams, students and broad public.
There are no dementia day centers in all cities of Greece. The few geriatric clinics and local dementia associations try to offer mental empowerment to people with mild cognitive impairment and dementia and relieve the burden of care to their families.
In the next 20 years, of course, I would like to see geriatric medicine as recognized as medical specialty and subspecialty in Greece. I would like to be able to come back to my birth country if I wish to work as a geriatrician. But most of all, we would like to see the transformation of the care of older people according to the principles of geriatric medicine. Of course, integrated geriatric services are not built up from scratch in 2 or 3 years' time. If we are looking for feasible solutions, a geriatric-oriented outpatient or domiciliary services could be a good start.
In the next 20 years, there is great needs for geriatrics in Greece, obviously the first being for it to be recognized as a subspecialty and for programs of official training to be created in the hospitals and community centers. But another thing that we desperately need somehow to be implemented even sooner than that is the initiation of co-care models. By that I mean having geriatric patients in hospital wards of cardiology or general surgery or orthopedics have 2 attending physicians, one who would be the specialist undertaking the procedure or the organ-specific admission, and the other should be a geriatrician, someone who understands frailty and disability and the psychosocial context of older patients and can help them get through this hospitalization without complications and transition out into the community and live their lives and age in place.
Our next target is to improve increase the day centers and have in every city one day center in Greece in order to help every patient with dementia from north to south. And also this year we'll have the opportunity to work in nursing homes which will be under the funding of Ministry of Health, one in North Greece in Thessaloniki and the other in South Greece in Kalamata, where we are going to care patients at the end stages of the disease in order to have a better quality of life.
Also, with other stakeholders, run educational programs for the older on smart technology in order to enhance electronic health literacy and independent home living.
Up until now, it has been very difficult to know what is happening with our older patients after discharge from the hospital. With the help of a mobile geriatric team, we can have the ability to visit our older patients in their own homes, adult care or nursing homes straight after discharge. A mobile geriatric team can have knowledge of patients' recent medical history and planning of follow-ups, can minimize hospital length thanks to earlier discharge, can minimize stress before discharge, can be easy to come in contact with, can provide better communication with the patient, their relatives and other caregivers, can minimize the total number of caregivers, can improve patients' safety, can reduce traditional healthcare utilization by expanding caregivers' capacity and capability, can provide enough time for the patient's problems in and out of the hospital facility, can integrate technology to secure a more efficient and effective outcome, can have access in real-time data on the state of health of seniors, can gather and share information which can help planning and optimize caregivers' training.
The majority of patients we see in the clinic are elderly. For some specific patients who are quite old or have complicated underlying conditions, the treatment management is quite challenging. I would like to have in the future the help of a geriatrician in order to better individualize the treatment decision.
Despite the fact that geriatrics is a composite word consisting of two Greek words and that Greece is one of the countries with the greatest representation of people over 65 and 85 years old, geriatrics is still unrecognized, underrepresented, and has not yet found its place in the medical society. In this unfavorable background, we are optimistic about the future of the specialty in Greece, as there are some important and promising developments across all relevant fields of geriatrics, education, clinical practice that are waiving the supportive foundation to build geriatrics.
For the future of geriatrics in Greece, I hope for the recognition and dissemination of this discipline among the health professionals, and I wish for the creation of infrastructures and services that will allow the continuous management and assessment of geriatric and frail people.